lesson about magnetic resonance imaging, or MRI. So the MRI creates detailed pictures. These are high-resolution pictures, and they're much more detailed than the X-ray or CT scan. It does this by using a magnetic field to realign the hydrogen atoms in the body, and then radio waves to cause them to make signals used for the pictures. Now, why would we need an MRI? So MRIs are perfect for getting a clearer look inside the body for proper diagnosis. Organs might be viewed like the brain, spinal cord for a clear neurological assessment. Vessels might be viewed, and even more clearly with contrast injections to light them up during the scan. MRIs can help to diagnose disease or infection in the bone, like osteomyelitis in this picture here. Infection and abscesses are also visualized very clearly to help make decisions on the patient's treatment. So when the doctor orders an MRI, I want you to explain the scan, what it is, and why the patient's getting it to them. For example, if the patient has severe cellulitis in the abdomen and the doctor wants to make sure there's not an abscess forming, you're just going to let them know, hey, this is why we're doing this. Your facility is going to have an MRI form that you're going to fill out by asking the patient questions, just to make sure they haven't had any metal exposure or metal placement in the body, because those might contradict the procedure. So the patient's going to go ahead and sign that. And then also if they're having contrast, they're going to have the patient sign a separate consent, which might be added to that form as well. You're then going to fax this sheet to MRI, to the radiology floor. That way they can look it over and make sure that they are able to have that test. Also, just make sure the patient's not claustrophobic. If they are, they might be able to just have some medication to help them relax, because that MRI can take a while and it's in a pretty tight space. So also, I want you to disconnect any IV lines before they go down, because they might need that IV for contrast, and also you just don't want to bring any extra poles down, because the MRI uses magnetic fields, right? So you don't want anything metal in that area that could be dangerous for the patient. By pulling it close to the patient or hitting the patient, it could even kill people. So when you get to the radiology room, you're going to position the patient on the MRI board, like right here. And it's going to be according to the body part being viewed. So ask the patient to stay still during the procedure so that a really clear picture can be taken. Remember to remove all metal from the room, because the scan uses those magnetic forces that may cause shifting of metal, resulting in damage. After the MRI scan is over, transfer the patient back from radiology. Check the IV for patency just by flushing it with saline before reconnecting any lines. The radiologist will interpret the scan for results, and then the doctor is going to actually give those results to the patient. So let's touch on patient education. It's super important that you emphasize the importance of a no metal during the scan. If the patient has any jewelry, piercings, they need to be removed before you take them down there. And if the patient did have any contrast during the test, let them know they're going to have to hold that metformin for 48 hours if they take that for their diabetes. This is going to help protect kidney function. The priority nursing concepts for the patient getting an MRI are safety, patient education, and patient-centered care. All right, now let's review the key points. So magnetic resonance and imaging, or MRIs, are high-resolution scans that are used to look inside the body, and they use magnetic and radio waves. The doctor might order an MRI to help diagnose the patient with any disease in the tissues, bone, organs, or vessels. Before you take them down, you want to make sure you fill out that MRI form, get patient consent, and remove any metal like piercings or jewelry before you take them down. Also, disconnect any lines. During the procedure, you're going to want to position the patient according to the body part being viewed. Ask them not to move during the test, and remove any extra metal from the room, like a wheelchair or the bed or anything like that. After the test, just let the patient know the radiologist is going to interpret the results, and then the doctor will explain the results to them. And if they do take metformin for diabetes, they shouldn't take that for 48 hours after contrast is provided, because we want to protect their kidney function. All right, guys, that's it on MRIs. Now go out and be your best self today. And as always, happy nursing.